Hypoglycemia level. Category E16, other disorders of pancreatic internal secretion, has been expanded and codes have been created to capture the levels of hypoglycemia. These new codes are intended to be reported as secondary diagnosis codes and should not be assigned as the principal, first listed code. The new codes are as follows. E16. A1, hypoglycemia level. E16. A2, hypoglycemia level 2. E16. A3, hypoglycemia level 3. Hypoglycemia is a low blood sugar, glucose, level defined as a measurable glucose concentration that is less than 70 mg per deciliter. A decreased blood glucose less than 70 mg per deciliter but more than 54 mg per deciliter is considered level 1 hypoglycemia. A blood glucose less than 54 mg per deciliter is considered level 2 hypoglycemia. Level 3 hypoglycemia is a severe event resulting in an altered mental and/or physical condition that requires immediate assistance. Hypoglycemia occurs in people with type 1 and type 2 diabetes mellitus, but non-diabetic patients can also have hypoglycemia that is idiopathic in nature. The risk factors for continued glucose levels less than 70 mg per deciliter are clinically significant. When left untreated, it can increase the risk of cardiovascular events, seizures, and coma, and can potentially be fatal. Code assignment is dependent on documentation by the provider in the medical record. Question. A patient presents to the emergency department after the onset of a seizure with notable clinical symptoms of blood glucose levels less than 54 mg per deciliter. After a comprehensive workup, the provider diagnosed level 2 hypoglycemia. How is level 2 hypoglycemia coded? Answer. Assign code E16.2, hypoglycemia, unspecified, and code E16. A2, hypoglycemia level 2, for level 2 hypoglycemia. Because the hypoglycemia is unspecified, code E16.2 is the appropriate code to assign for the hypoglycemia. In addition, the use additional code note under code E16.2 makes it clear that both codes should be assigned. The tabular list of diseases may be referenced as follows. E16.2, hypoglycemia, unspecified. Use additional code for hypoglycemia level, if applicable, E16. A.